Hello, everyone. I'm Dr. Jonathan Stine, and today I want to talk about a condition called metabolic dysfunction associated steatotic liver disease, or MASLD. You may have heard it called fatty liver disease. Now, this is a common condition, but many people do not realize they have it because it usually does not cause symptoms, at least at first. So, what is MASLD, and why should you care about it? Let's break it down. Now, your liver is a very important organ. It helps with food digestion, stores energy, and cleans out toxins from your body. But sometimes fat builds up in the liver. And if too much fat collects in the liver, more than 5% to be exact, and without any other cause, then you have MASLD. Now, the good news here is that MASLD by itself is not always dangerous. And many people who are living with it never develop liver problems. But for some, MASLD can get worse over time. When too much fat builds up in the liver, it can cause inflammation, meaning the liver gets irritated and swollen. This is called metabolic dysfunction associated steatohepatitis, or MASH. And this is a more serious condition because the inflammation starts to damage the cells of the liver. Now, your liver is very good at healing itself, but if this damage happens over and over and over again, scar tissue starts to form, and we call this scarring fibrosis. I want you to think of this like a cut on your skin. If you keep scratching it, it never heals properly and leaves a scar. Now, the same thing happens in the liver when it is repeatedly damaged. And the more scar tissue there is, the harder it is for the liver to continue to work properly. Over many years, fibrosis or scarring can turn into cirrhosis, which we think of as even more severe scarring of the liver. And cirrhosis makes it very difficult for the liver to do its many jobs. And once cirrhosis develops, there is a much greater risk of liver failure or even liver cancer. At this stage, treatment options become more limited, and some people may need a life-saving liver transplantation. So what is the takeaway message? Well, MASLD is a common condition, but it doesn't have to lead to serious liver disease. By making small, healthy lifestyle changes, you can protect your liver and prevent complications like cirrhosis or liver cancer. Remember, if you are at risk, talk to your doctor about getting your liver checked because your liver works hard for you, and let's take care of it together.